Hello, class, and welcome to This Week in Health Psychology. This week we will be exploring cancer and the psychological impacts and how to care for people with cancer. So, what is cancer? Cancer is defined as an uncontrolled growth of abnormal cells, which produces tumors called neoplasms. There are two types of tumor: benign tumors, which do not spread throughout the body, and malignant tumors, which show metastasis or which metastasize. And that's essentially the process of cells breaking off from the tumor and moving elsewhere in order to set up camp, thereby spreading the cancer. There are three types of cancer cells: carcinomas, which constitute 90% of all cancer cells and which originate in tissue cells; sarcomas, which originate in connective tissue; and leukemias, which originate in the blood. The role of psychology in cancer is an interesting one. A role for psychology in cancer was first suggested by Galen around 200 to 300 AD, or in the Common Era, who argued for an association between melancholia and cancer, and also by Gedman in the 1700s, like 1701 actually, who suggested that cancer might be related to life disasters. Now, 85% of cancers are thought to be potentially avoidable. Psychology, therefore, plays a role in terms of attitudes and beliefs about cancer, as well as through predicting behaviors such as smoking or diet, and even screening, which are implicated in its initiation. In addition, sufferers of cancer report psychological consequences, which have implications for their quality of life. The role of psychology in cancer is also illustrated by various observations. First off, cancer cells are present in most people, but not everybody gets cancer. In addition, although research suggests a link between smoking and lung cancer, not all heavy smokers get lung cancer. So perhaps psychology is involved in the susceptibility to cancer, specifically through things like stress and stress management, an approach to life. All those who have cancer do not always show progression towards death at the same rate. So perhaps psychology has a role to play in the progression of cancer, at least some cancers. And finally, not all cancer sufferers die of cancer. Perhaps psychology has a role to play in longevity, although in this case, depending upon the type of cancer, longevity does not seem to have a strong psychological component. The psychosocial factors in the initiation and promotion of cancer. There are various aspects to this. First off, behavioral factors. Behavioral factors have been shown to play a role in the initiation and promotion of cancer. For example, Smith and Jacobson reported that 30% of cancers are related to tobacco use. 35% are related to diet. 7% are due to reproductive and sexual behavior. And 3% are due to alcohol. So these behaviors can be predicted by examining individual health beliefs. Then stress. Stress has been shown to have a role to play in cancer. Laudenschläger and associated researchers related a study that involved exposing cancer-prone mice to stress. So, for example, shaking the cage. They found that if this stressor could be controlled, there was a decrease in the rate of tumor development. However, if the stress was perceived as uncontrollable, this resulted in an increase in the development. This suggests a role for stress in the initiation of cancer. However, Sklar and Anusman argued that an increase in stress increased the promotion of cancer, not its initiation. Then, life events. It's also been suggested that life events play a role in cancer. A study by Jacobs and Charles examined the differences in life events between families who had a cancer victim and families who did not. They reported that in families who had a cancer victim, there were higher numbers who had moved houses, higher numbers who had changed some form of their behavior, higher numbers who had had a change in health status other than the cancer person, and higher numbers of divorces, indicating that life events may well be a factor contributing to the onset of cancer. However, the results of a meta-analysis by Pettigrew and associated researchers did not support this suggestion. They identified 29 studies that met their inclusion criteria, for example, adult women with breast cancer, group of cancer-free controls, measure of stressful life events, and concluded that although several individual studies report a relationship between life events and breast cancer, when methodological problems are taken into account and when the data across the different studies are merged, the research shows no good evidence of a relationship between stressful life events and breast cancer. So in that particular type of cancer, at least, there does not seem to be a significant predictor. Issues of control may play a factor in the promotion and initiation of cancer. So control may also seem to play a role in the initiation and promotion of cancer, and it has been argued that control over stressors and control over environmental factors may be related to an increase in the onset of cancer, specifically related to stress illness links. Coping style. So coping style also seems to be important. If an individual is subjected to stress, then the methods they use to cope with this stress may well be related to the onset of cancer. For example, maladaptive disengagement. Coping strategies such as smoking and alcohol may have a relationship with an increase in cancer. Depression. Some researchers highlight a relationship between depression and cancer and suggest that chronic mild depression, but not clinical depression, may be related to cancer. Personality. So over the past few years, there have been some interesting studies looking at the relationship between personality and cancer. Temeshok and Fox argued that individuals who develop cancer have a type C personality. And if you remember, a type C personality is described as passive, appeasing, helpless, other-focused, and unexpressive of emotion. Eysenck described a cancer-prone personality and suggested that this is characteristic of individuals who react to stress with helplessness and hopelessness, and individuals who repress emotional reactions to life events. And then finally, issues of hardiness. Kobasa and associated researchers described a coping style called hardiness, which has three components: control, commitment, and challenge. Low control suggests a tendency to show feelings of helplessness in the face of stress. Commitment is defined as the opposite of alienation. Individuals high in commitment find meaning in their work, values, and personal relationships. Individuals high in challenge regard potentially stressful events as a challenge to be met with expected success. Hardiness may be protective in developing cancer, research seems to show. So, there are also obviously psychological consequences of cancer. For example, with emotional responses, up to 20% of cancer patients may show severe depression, grief, lack of control, personality change, anger, and anxiety. Pinder and associated researchers examined the emotional responses of women with operable breast cancer and reported that these can differ widely from little disruption of mood to clinical states of depression and anxiety. Whatever the case, the emotional state of breast cancer sufferers appears to be unrelated to the type of surgery they have, whether or not they have radiotherapy, and is also only affected by chemotherapy in the medium term. However, persistent deterioration in mood does seem to be related to previous psychiatric history, a lack of social support, age, and a lack of an intimate relationship. Then there are cognitive responses, and research has also examined cognitive responses to cancer and suggests that a fighting spirit is negatively correlated with anxiety and depression, while fatalism, helplessness, and anxious preoccupation are related to lowered mood. Taylor examined the cognitive adaptation of 78 women with breast cancer and reported that these women responded to their cancer in 3 ways. First, they made a search for meaning, whereby cancer patients attempted to understand why they had developed cancer. Meanings that were reported included stress, hereditary factors, ingested carcinogens such as birth control pills, environmental carcinogens such as chemical waste, diet, and a blow to the breast. Second, they also attempted to gain a sense of mastery by believing that they could control their cancer and any relapses. Such attempts at control included mediation, positive thinking, and a belief that the original cause is no longer in effect. Third, the women began a process of self-enhancement. This involved social comparison, whereby the women tended to analyze their condition in terms of others they knew. Taylor argued that they showed downward comparison, which involved comparing themselves to others worse off, thus improving their beliefs about their situation. According to Taylor's theory of cognitive adaptation, the combination of meaning, mastery, and self-enhancement creates illusions, which are a central component of attempts to cope. Psychology also has a role to play in the alleviation of symptoms of cancer and in promoting quality of life. Cartwright and associated researchers described the experiences of cancer sufferers, which included very distressing pain, breathing difficulties, vomiting, sleeplessness, loss of bowel and bladder control, loss of appetite, and mental confusion. Psychosocial interventions have therefore been used to attempt to alleviate some of these symptoms of the cancer sufferer and to improve their quality of life. Things like pain management. So one of the main roles of psychology is in terms of pain management. And this has taken place through a variety of different pain management techniques. For example, things like biofeedback and hypnosis have been shown to decrease pain. Researchers have also encouraged patients with cancer to describe and monitor their pain, encouraged them to develop coping skills, taught them relaxation skills, encouraged them to do positive imagery, and to focus on other things. They reported that these techniques were successful in reducing the pain experience. Social support interventions have also been used through the provision of support groups, which emphasize control and meaningful activities and aim to reduce denial and promote hope. It's been suggested that although this intervention may not have any effect on longevity, it may improve the meaningfulness of the cancer patient's life. In line with this, researchers have explored the relationship between social support, coping, and positive adaptation to breast cancer in 56 women. And the results showed that higher levels of perceived social support and approach coping strategies are related to positive adjustment. Now, psychology has also been involved in the treating of nausea and vomiting experienced by cancer patients. In this case, cancer patients are often offered chemotherapy as a treatment for their cancer, which can cause anticipatory nausea, vomiting, and anxiety. Respondent conditioning and visual imagery, relaxation, hypnosis, and desensitization have been shown to decrease nausea and anxiety in cancer patients. Red in the 1980s and Burish and associated researchers suggest that 25 to 33% of cancer patients show conditioned vomiting, and 60% show anticipatory anxiety. So it has been reported that relaxation and guided imagery may decrease these problems. Then the quality of life of cancer patients may also be improved by altering body image counseling, particularly following the loss of a breast and more generally in dealing with the grief of the loss of various parts of the body or bodily functioning. Research has also suggested that quality of life may also be improved using cognitive adaptation strategies. Taylor, for example, used such strategies to improve patients' self-worth, their ability to be close to others, and improvement in the meaningfulness of their lives. Such methods have been suggested to involve self-transcendence, and this has again been related to the improvement of well-being and decrease in illness-related distresses. So overall, it seems clear that psychology has a significant role to play not only in the prevention or progression of cancer and the initiation of cancer, but also in the treatment and management of symptoms. However, there does not seem to be a significant psychological component once severe cancer has developed to the longevity of cancer. So it doesn't seem to be, once severe cancer has developed, to be something you can think your way out of. However, as I've mentioned, in the initiation stage and the early progression stage, psychology certainly is important, as well as important in the quality of life of the individual suffering from cancer. That's it for our lecture this week. I hope you enjoyed, and I'll see you next week. You take care. Bye-bye.